There's been some progress in controlling Uganda's HIV epidemic, according to the latest figures. Preliminary results show the prevalence among adults aged 15 to 49 years was 7.1% among women and 3.8% among men. This represents a 0.5% drop in HIV prevalence compared to the last assessment done in 2016. The latest figures, according to health authorities, demonstrate that Uganda is well positioned to achieve the UN AIDS goal to end the HIV epidemic by 2030.
Over 3/4 of people living with HIV had suppressed viral load, meaning that treatment programs are successfully reaching the majority of the population living with HIV.
The findings indicate that over 90% of HIV-positive people enrolled on treatment have the virus undetectable in their bodies. However, the report shows a higher prevalence of HIV in urban areas compared to rural areas, and the highest HIV prevalence registered among older individuals and lowest in the younger age groups.
We are increasingly seeing the burden shifting to older people, and we want to make sure that we focus on older people.
The survey collected information about the uptake of HIV prevention, care, treatment services, and offered home-based HIV counseling and testing. The Minister of Health says a significant number of HIV-positive people have been identified and put on treatment, and a substantial number have become healthier, which has reduced the number of HIV-related deaths. The current survey shows 1.3 million Ugandans are living with HIV. The UN AIDS strategy to end AIDS by 2030 is to get 95% of people living with HIV know their HIV status, 95% of people who know their status on treatment, and 95% of people on treatment with suppressed viral loads.
This more granular understanding of the HIV epidemics allows us to focus efforts towards the geographic areas and populations in greatest need as we aim to deliver the right interventions in the right places, right now, and in the right way.
The 2020 survey was conducted by Uganda's Ministry of Health in collaboration with Columbia University and funded by the US government with technical assistance from the US Centers for Disease Control and Prevention.